YouTube family, welcome to my channel, and this is Nurse Janet. Today I will be doing a quick Q&A on topics concerning nursing. For my first question I have here, why did you become a nurse? I became a nurse because when I was a little girl, my hero, my grandfather, suffered from diabetes. And at the age of 16, he died from complications concerning diabetes. And from that day forth, I really wanted to help people just like him. So that motivated me to go to school to be a nurse. My second question is, do you think moving from Louisiana to Texas was a good move for your career? Yes, I think it was a good move because Texas has so many opportunities for nurses. If you're a nurse and you need a job, you will have jobs coming at you from everywhere because it is so many opportunities here. There's so many hospitals, so many healthcare facilities, agencies that's looking for people to work here in Texas. The third question is, how do you prevent yourself from getting sick while working in the hospital? Well, everybody who is a nurse know that when you first change job in any hospital, you will get sick, so you almost can't avoid it. And then once your immune system pick up, you won't get sick again. But for the most part, how you keep yourself from getting sick is proper hand washing technique. I just started a new job as a pediatric nurse earlier this year, in the beginning of this year, and I really didn't get sick, and I thought I was going to be really sick because kids are super germy. But what helped me is that I went in and I made sure that I did proper hand hygiene. And one thing I know is that you have to use proper PPE, and that's mean that if they are coughing too much, they have a respiratory isolation, I wear my mask and my gown. And also when you're doing procedures, wear gloves. And you got to remember to always wash your hand before putting the gloves on, and wash it when taking the gloves out. And me, I just double wash. When I walk out the room, even if I wash my hands after I take off my gloves in the room, once I walk out of the room, I still wash my hand. It's always to be extra cautious than to, skip steps. So I just double wash my hand. And also, I take vitamin C. That's a good thing for also protecting yourself. My next question is, what's your favorite part about being a nurse? I love sticking people. I just do. I like when it's time for to draw blood or anything. Like a lot of hospitals, they have phlebotomists and they do all the blood draws or whatever. But I love taking blood from people. I love giving shots and everything. But on a serious note, another thing I like about being a nurse is that I just love when I come in and a patient recover after having a bad disease that we really thought that person wouldn't recover from, and just to see the progression of that patient and to see them walk out, that is an awesome feeling. So that's what my favorite part about being a nurse. My next question is, how was your last shift? My last shift was very odd. It was really crazy because I came in, usually they give us patients and our room assignments be really close together. If I have patients, it'd be 1, 2, 3, and 4 or 5. And this day I had room 1, room 6, room 14. So I was all over the place, running all over the place. And another thing is, my patients I had a really sick child that came from ICU, and then I had a patient that was just chilling, not even should be in the hospital. So it was just weird to me, and it was just a different night. And so I'll say that it was an odd night. It wasn't my normal night, and it was I was running around like a chicken with their head cut off. So it was a very odd night for me. What's your weekly schedule like as a RN? My weekly schedule is I work 3 12-hour shifts. I like to have them 3 days in a row, either 2 12-hour shifts and then some days off, and then 1 night shift, 12-hour shift. Because at working nights, if you don't have days together, it's going to be like you never off, because you got to understand, you go to work one day and you get off another day. So if you only have 1 day off, it's like you never had a day off. And so I like to bunch them up. And that works well for me and my family. The next question is, how was nursing school? It was so stressful. And another thing about nursing school, I remember I missed out on a lot of trips with my family. I really missed out on everything. I got, for example, my family went to New York and I wasn't able to go with them because I had to study. And it was my last clinical, it was my last semester in school, and I couldn't go. And I really wanted to go, but it did, by me not going, it helped my grade out a lot because I passed with an A in that class. And that's not normal in nursing. They say you see your way out. So the thing about it is you miss a lot of family time. You have a lot of stress. But the good thing about nursing school is I built friendships that last a lifetime. I really have good friends from nursing school, and those friends they are more in my life than my friends from high school. The next question is, what are some tips for nursing students? One tip is to get a study partner. I think that it is so vital for you to have a study partner. When I was in school, I had one friend that I studied with every session, and also we had a group that we studied with. And I think it is so essential that you have that person all the way through nursing school. Because if you have that person, if you're weak or you miss something, that person will catch it for you. And if you know something and that person missed something, you will be able to help that person out. And it's just good to have somebody that you can depend on. Another thing is get really close with your librarian, because in nursing school you're going to have to do a lot of papers, you're going to have to do a lot of research, and it's just good to be close to your librarians. Because when I was in nursing school, whatever I need a book, whenever I need a topic, whatever, anything I need, a journal article or whatever, they were available to me. They sent them to me. All times of the night. They would always assist me because we had that working relationship. And that's a good person to have in your life. And also in nursing school, you should get caught up on your reading. Because if you don't get caught up on your reading, you will fall behind. Because in nursing school, they give you, not chapters, they give you units. And units consist of 10, 20 chapters. And if you get behind on your reading, you're going to fail your test. So it's best to always make sure that you're ahead of the game in your reading and your assignments. Because if you don't, you're going to fall behind. And when I went to nursing school, it started out with so many of us. But when I graduated, I can remember about 50 people failing. And they did not graduate from nursing school. So you need to stay on top of your studying. You need to stay on top of your reading. And make sure when you're reading, because this is something that helped me, don't read just to pass the test. Read to understand it and know it. Because when you read something and you know it, I don't care what happens, you're going to always know it for the rest of your life. You might not remember everything in nursing school, but you're going to know the basics. So I always when I read my chapters, I read it where I can understand it and not just be reading for memorization. Because it's known that when kids get out of high school, they used to studying for memorization. You can't do that in nursing school. You need to know it. And really, why wouldn't you want to know it? You're dealing with people's lives. So study to know it. Read your chapters. Read your units ahead of time. Stay caught up. Make sure you have a relationship with your librarian, and also get you a study partner. How much money do nurses make? It just depends. It basically depends on the hospital. It depends on where you live. Because, like, if you live in New York, you're going to make more money. But you got to understand the cost of living in New York is way higher than the cost of living in Texas. So it depends on where you live. But here in Texas, the new grads usually make a base pay of $29 per hour. But if you work a night shift, that you'll get that $29 an hour, and then you'll get between $4 to $10 more for night shift. So just say you're on a higher end, you get the $10 a night. So 29 plus the 10 is 39. And then if you work weekends, it usually be between 4 and 10 too. So say on the higher end, if you got that 10, then it'll be $49 an hour for working that weekend for 12 hours. Me, I'm an experienced nurse, so I wouldn't work anywhere for $29 an hour. I'm not being ungrateful, but I know what I put in the hours, I put in the time, and so I expect more than that. But I'm so thankful for whatever they give me, and I'm not in it for the money, but I haven't seen $29 an hour since I started nursing school, and that's been a long time ago. But even most people, I'm not average anyway, because like most people don't do what I did when I first got out of nursing school. My first year I made over $100,000 a year, and that's usually not heard of. So it just depends. It depends on if you're doing travel nursing. It depends on if you're, your contract nursing, and it also depends on your years of service in the nursing field. So, and it also depends on the hospital, because the hospital I work at now, they pay on the lower end, and the only reason why I'm getting paid a lot is because of contract at the moment. And so it just depends on the hospital. The next question is, how do you use your downtime at work? Well, me, I like to do research on my patients' different illnesses. The thing about me, when I come on shift, I usually sit down. I come in early. I sit down and I look at my patients. I get my patients, and then I look down and I look in the computer and see what their disease processes is, and then I go through that and look at all their labs and everything. And so, but because we are so busy and we really don't have a lot of downtime, so if I do get a lot of downtime, some of the patients have like 20 things going on with them. Because you got to realize that they probably had a history a long time. In the pediatric world, even in the pediatric world, some kids come in with 10 different things going on with them. So when that time come, I just look back over their disease processes, because I've been out of nursing school a while, and so I have to go back, and even the new nursing students, we have to go back and continually learn stuff, because there's a lot of stuff that we didn't learn, or it's changing. Healthcare changes. Just because it was this way one day, 5 years later, it's totally different. So you always have to go back and read research. And another thing I do, if I'm good on my patients, I know what's going on, I know all their disease processes, I go and do my annual test for the hospital. If you're a healthcare worker, you're going to have so many little tests you have to do for your competency. And so basically I go in and try to do a couple of them a night, just to make sure I stay on top of it, because if you don't, you can get suspended from the hospital and you won't be able to work until you complete those tests. The next question is, do you manage to get a restroom break during the 12-hour shift? Yes, I do. Basically, I've learned that in order to take care of someone, you have to first take care of yourself. So I truly believe in self-care. A restroom break, take it. It's only like 2 minutes. And the thing about it is, when I first got out of nursing school, I did not take out time to do that. I would go the whole 12-hour shift and never use the restroom. But in that, I was doing so much, running and doing everything and being there for my patients, being there for my co-workers, trying to keep myself busy. I got burned out. And so now I stop and try to, do what I need to do, take care of myself and eat right and do the necessary things I need to do so that I can stay healthy for myself and for my patients. The next question is, what are the pros and cons of day shift versus night shift? The good thing about day shift is they have so many resources available to them. During the day shift, you have your managers, you have all the doctors there, you have physical therapists there, you have occupational speech therapy, you have pharmacy there, you have so many people at your disposal, and you have just abundance of just resources. But at night, you really don't have all that. You have to call the doctor at night, and he might be irritated with you because you done woke him up at night, and the question might be small to him, but it's big to you. Or it may be your patient wants something simple, but they want it, and you gotta ask them for it, and the doctors be so extremely mad at you, but that's the part of your job. But the pros of night shift to me is, it is so chill, it's so relaxed. Everybody is just so happy, welcoming. The patients are ready to wind down, so they're not just on the light all day pushing and telling you to do anything. And I noticed that day shift workers versus night shift workers are very chill, and the day shift workers seem like they be like just uptight, stressed out and everything. So I like working night shift for that, but I like day shift because you get more time with your family. Because when you work night shift, when you're off, you usually be sleeping, trying to catch up on sleep, so you really don't get to enjoy yourself like the day shift people. Another question is, do you prefer 3 12-hour shifts or 5 8-hour shifts, and why? I prefer 3 12-hour shifts, because when you get 3 12-hour shifts, you have 4 days to be with your family, relax, and you just have more of a life. When you have 5 8-hour shifts, you only have the weekend, and that really sucks. And if you have a night shift and you working all that time, then it seems like those 2 days go by so quickly. So I prefer to do those 312s and have the rest of the week to do whatever I need to do, and then catch up on bills, catch up on my kids, catch up on anything that I missed during the week. Another question is, what are your thoughts on nurses working 2 jobs? I feel like to each his own. If you want to work 2 jobs, that's between you and your family. Me, I really don't like working 2 jobs. I'd rather work 1, but at the moment I have 2, but it seems like I don't have but 1, because I have my full-time job, and then I have, which I work 3 12-hour shifts a week, and then I have an agency job, and I go to that when I want to. I get paid the same day when I go to. So basically it works like this. I tell them when I want to work, and if they have availability, I go. If I don't want to go, I don't have to go. If I do go, I get paid that same day. I get paid at a higher rate than I get paid working in a hospital. And I'm never, like, I don't have a set. Like, some agency jobs, it's like they have it where you have to work so many days out of a month or so many days out of a year. But my agency job, I don't have to ever come, or I can come as many times as I want to. It's basically me. I'm my own boss concerning that job. So I love it. So when I need extra money, I pick up some days. If I want to do something just special for somebody and I don't want to take out of my money, I go and do that job. If I need money to just blow, to just splurge on something, I can go to that job, and it's just really good to have. So nurses working 2 jobs, I think it just depends on your family, depends on your needs. And like I know so many nurses, they have 3 4 agency jobs, and they have a full-time job, and they're doing pretty well, and that's just something they do. So it's okay with me in my book. The last question is, what is the hardest part to being a nurse? The hardest part to being a nurse, that's a good question. The hardest part to being a nurse is you never know what's going to happen in a shift. Anything could happen, and you just have to always be ready. Another thing is fear. Nurses always walk in fear because you never know if your patient's going to die. You have a fear of, basically, am I going to make a mistake? You have a fear of, are you going to finish that documentation? Not if you're going to finish it. It's just basically, you go home like dreaming in your head, did I leave something out? Did I do this? Did I do this right? Did I document this? Because if you didn't document it, it's not done. That's in the nursing world. Any nurse knows, if you did not document it, it's not done. You didn't do it. And it does not hold up in court. So basically, we have a fear that did we do everything we need to do, and did we document? And also a fear of making a mistake, like, did we give the right medication? Did we give the right amount of medication? Did we push the drug slow enough? Were we supposed to push that drug? So those are some fears. And also, it is another hard part about being away from being a nurse is that you have to be away from your family. And that's hard for me because I love being with my girls. I really, really love being with my kids. So being a nurse, those long hours away from your kids feel like an eternity. And so that has been a hard part to me. And that's all I have for you guys. So I hope you like my Q&A. If you have some questions that I did not answer in this Q&A, please leave them in the comments and I will answer them at a later date. Before you leave this video, please like, comment, and subscribe.